Are you ready to start your podcast?
I'm excited. I think this will be fun.
What's the first one going to be about?
Schools and how they help keep kids healthy. All right, can you count down from 3 for me?
Three, two, one.
Let's go. Welcome to the Dose of Optimism, where I talk to the optimists in healthcare. My name is Omkar Kulkarni, and I work at one of the world's best children's hospitals where I lead innovation. I started KidsX, which is a premier international startup accelerator for pediatric innovation. And over the years, I've met thousands of startups, investors, and innovators. Every one of them has a story, and every one of them is optimistic about the problems they're solving. On this podcast, you'll meet amazing people who will share their stories and what makes them optimistic about the future of healthcare. A little note before you get into this episode. This podcast is for informational purposes only. We are not offering medical advice, and we're not endorsing any products. Please talk to your own physician about your health or the health of your children. All right, let's get started. In our first episode, we focus on schools and the role they play in enabling the health of children and teenagers. Think about it. Kids spend 6 to 10 hours each day at school or in school-based activities. The adults in these schools are able to help see the physical and mental health of our children in ways that many parents and family members are not able to see. I talked first to Dr. Smita Malhotra. She's a pediatrician in Los Angeles, and she's the medical director of the Los Angeles Unified School District. This is the second largest school district in the country, and through her role, she's able to impact the lives of over 500,000 children who go to the school. It's a great conversation. We talk about mental health, dental health, the importance of data sharing between pediatricians and school districts. But one thing that stuck out to me was the importance of adult role models in the lives of children. And for many children in Los Angeles, that role model may actually be somebody who works at the school. Here's the full interview with Dr. Smita Malhotra. Are there a lot of people who have jobs similar to yours? So tell us a little bit about what your job is and role is. And I'm just curious if that exists in a lot of other school districts.
Great question. I'm the chief medical director for Los Angeles Unified School District. So I oversee all of our healthcare services in the district, which includes student mental health, student medical services, district nursing services, employee health, and emergency response. So anything health related in the school district is under me. This is a very unique position. It actually came about after the COVID pandemic. So I started at LAUSD in January of 2021. I was brought to help reopen schools in the middle of the pandemic, an incredibly challenging time for schools throughout the nation. This is a very unique position. Very few school districts have a role like this.
I think having pediatric leadership within a school district is so important. Give us a lay of the land. So it's a huge school district. You're taking care of lots of people. What is your population that you're serving?
We have over 400,000 students, 75,000 staff members. More than 80% of our students come from families living in poverty. This comes with a lack of access to healthcare, mental and physical healthcare. And so what we're dealing with is how do we bring healthcare access directly to where our children spend most of their days, which is in school. And how can we maximize that and make health accessible for all of our students who do not have not only the access, but the means to even get to a healthcare provider when their parents are working 2 and 3 jobs. I've had students who've lived with a sprained ankle, probably broken ankle for weeks and can't get to a healthcare provider, can't get their sports physicals. So that's what we're dealing with. How do we make healthcare accessible for all of our students?
And it's an interesting paradigm because a lot of these kids are spending, I imagine, maybe even more time with you than waking hours at home with parents, especially working parents. And so perhaps you have more eyes and ears on them, their symptoms, their healthcare, their wellness, perhaps, than some parents whom they may not get as much time with.
Exactly. Schools are really like pillars in our communities. Schools are where children get access to nutrition, access to mental health care, access to physical health care. access to a trusted adult. The single greatest protective factor for resilience in children is a consistent, reliable, nurturing relationship with an adult. And a lot of times that adult is not always at home. That adult is in the school for the kids. And so it is that trusted adult that has eyes on the child and knows what that child needs and where that child is suffering. This is a great opportunity. That schools are the place where we can create what we want to do going forward is create schools as health hubs and ensure that they can get all their healthcare needs met within the school setting.
So, what are the big priorities for your school district right now, and what are you looking forward to in this next year?
The big priority is make healthcare accessible. How do we bring dental care, vision care, medical care, immunizations into schools, physicals into schools? We have partnered with so many great organizations that have brought vision care to our schools. So we've had Saturday fairs, we've had partners going into the school settings where right on site they get a vision exam and then eyeglasses right on site, all for free at no cost to the district or to families. So, all of our healthcare partners have done this at no cost to the district or to families, which is quite incredible. We've also brought dental care into our schools. It's fascinating to see children sitting in a school auditorium in a dental chair getting a full teeth cleaning or their cavities filled. It's incredible. This past year, we brought also telehealth into our schools. So, both mental and physical telehealth. With physical telehealth, if a child is not feeling well in school, they go to our nurse who then connects with a provider through telehealth. And right on the spot, that provider can say, this is just a minor headache. This is just cramps. Give this medication to the child, watch them, and they go back to school the same day. Or if they need a prescription, it's called in that same day and the child comes back to school faster. With mental telehealth, this is incredible because when I was practicing before this in private practice, I would always tell patients therapy is a luxury. It can be hard to get into a therapist, and then it costs a lot of money. But in our school district, we are providing access to mental health care through telehealth in school or at home, no cost to families, no cost to the district. Any parent in the district can go onto their parent portal and request mental health services for their child. And it does not have to be a mental health crisis, it can be for anything.
That's really interesting. A couple things to ask you there. So, I remember you talking at some point in the past about the simplicity of some of the access needs that are existing, like a toothbrush and eyeglasses, like you're talking about dental care and vision care. Some of those things are perhaps not even available to some of our kids. It's fascinating what you're doing. I was just reading about Illinois. They're thinking about making a mental health assessment part of a standard in the future, making sure kids have mental health screening or mental health access. What is your thought on that? Is that something that you think we'll see more of across the country?
I would love for California to do that. So here in LAUSD, we're inching towards that. So what we implemented this past year is the Student Joy and Wellness Plan. So this is a digital plan that we implementing district wide for every student where whoever the trusted adult is for that student, whether it's a psychiatric social worker, a teacher, staff member, goes through with the student what their general mental health is at that time. Are they feeling anxious? Are they feeling depressed? What are their coping strategies? Who is their trusted adult in the school? What is the plan to help this student with their joy and wellness so that we are addressing issues before they become crises? Similar to a mental health screening, not quite there yet, but I would love for California to implement this as well because this is how we get proactive about mental health. This is how we prevent crises from happening, especially crises in schools from happening.
So you've got access for kids through telehealth, telemental health. You've got vision care, dental care. What more are you excited about? I mean, there's so much that's happening already. What's next on the horizon?
So, in addition to all of that, what we are implementing this year is something that we also call Fast Pass physicals. We want to bring healthcare providers throughout the county to partner with our school district. Now, We are in very challenging times right now. Our children are going through a lot of trauma, a lot of fear with the immigration raids that are happening throughout our county. Our children are experiencing fear of deportation, fear of being forgotten, fear of being marginalized. And we know fear is a toxin, and they're breathing it in every day. And now more than ever is where we need to wrap around our communities, wrap around our students, and bring that health care to where they're at school or where they're at home. We are partnering with several healthcare providers throughout our county to bring physical exams into our school settings so that any child can get their annual physical right within the school setting or their sports physical in the school setting. We also are expanding our telehealth mental health services to where we're doing family therapy in the home. We always have all these initiatives for students, but who's taking care of the caregivers who care for the students? Going forward, we have providers that will be doing family therapy in the home for the students and their parents. So we're really expanding in different ways to see how we can come together to ensure that no child loses access to medical care, regardless of their race, religion, or immigration status.
That's incredible. I imagine parent partnership is really key. So just curious how you engage with the parents.
We definitely need parental buy-in, even for our telehealth initiatives. We needed parental consent. And so that was a big thing that we worked on. We learned a lot through that. So, what LAUSD has actually, we have a very big parent and family engagement division that works specifically on that. And they have connections to what we call parent reps throughout the district. Like students will only listen to other students, parents listen to other parents. Just like our student advisory council, we have parent representatives throughout our district. And so the first step is reaching those parent representatives, getting their buy in, understanding and answering their questions. And then they will go and talk to other parents about our initiatives. We learned this a COVID pandemic when we were talking about COVID vaccines. No one was going to listen to a doctor in the district talking about COVID vaccine. They were going to listen to parents. They were going to listen to other students. Those were our biggest messengers. And we use the same concept. When you get the parent rep buy-ins, the parents who represent all the other parents, they really listen.
This brings up another question that I had for you. So, what's really fascinating about your district is not only how big it is, but how diverse it is. You have perhaps some of the most impoverished parts of maybe even the state or the country that are part of the district, but you also have some neighborhoods and some districts that are in somewhat affluent areas because Los Angeles is a pretty diverse city. You probably also have a lot of language, cultural, ethnic diversity amongst your population as well. And it's so big, as you mentioned at the beginning. So, as you think about any new initiative, whether it's mental health, physical health, food, any of the things we've talked about, how do you design something with such a diverse population in mind? And then how do you achieve that scale?
That's a great question. Los Angeles Unified has been navigating that for years. When almost 40 years ago, the district started investing in wellness centers and school based health centers, they asked that same question. How do we design the LAUSD healthcare system throughout our district while keeping the highest needs in mind? And what we have developed in partnership with the county is something called the heat index. It's LAUSD specific. And so for healthcare, it's really looking at the highest rates of chronic disease in an areas that are healthcare deserts, as well as county factors, highest ER visits, teen pregnancies. And so we've identified areas in the district that are of highest needs, and that's where we direct, okay, this is where we need a wellness center. This is where we need a school-based health center. In addition, our superintendent has identified a little over 100 schools that he calls priority schools, which are based on schools that are in areas with high needs, but also high academic needs as well, and areas with the highest number of kids on the free school lunch program, which may or may not continue. But based on all of these factors, we've also identified these 100 or so priority schools.
So let's talk a little bit about data. For a parent, the children's hospital has health information about them. Their pediatrician and their doctor's office has information, whether it's a private office or an FQHC. And the school has a large amount of health data as well. What are your thoughts around interoperability or eventually maybe even a future where there is like a unified health record that's pulling from all of those sources? So that the parent has access to the data that they need, but also that each of the kind of pillars of the child's life, the pediatrician, the hospital, if they go to one, and also their school, that those people are all aware of what's happening and there's data sharing across. What is your thought about that?
I absolutely love this question because that is another innovative thing we are working on this next year, actually, in partnership with CHLA and UCLA and LAUSD. In LA, we have what we call LANES, the Los Angeles Network for Enhanced Services, and it is basically a data sharing platform. So I do believe a lot of healthcare partners are already on it. CHLA, UCLA, the county, they're all on it, where healthcare information is shared. Our goal with LAUSD, we're going through the process right now, but we want to get on this same data sharing platform. So where we will share with the healthcare community attendance data for students. And from there, CHLA and UCLA and the county can find those patients that have high rates of chronic absenteeism and bring those patients, address any medical or chronic medical needs. Really, the concept is that absenteeism and keeping kids in school is not just responsibility of a school district. It's a responsibility of, like you said, all the pillars that affect a child's life, and that includes pediatricians and their doctors.
Dr. Malhotra, thank you so much for joining us and for sharing all the great work you're doing at Los Angeles Unified.
Thank you so much for having me. It's an honor.
And now a thank you to our generous sponsors.
All right, we want to thank our sponsors for A Dose of Optimism. Our first sponsor is Nabla. Nabla, this will help keep us practicing longer. For 85,000 clinicians and counting, Nabla is the key to better balance. With real-time notes and dictation in one platform, clinicians are saving hours on documentation time and strengthening patient satisfaction. Learn more on nabla.com. And to Mercury Bank, online business banking for startups and small businesses. Go to Mercury Bank for powerful banking, simplified finances. And finally, we want to thank our presenting sponsor, KidsX. KidsX is a global ecosystem of pediatric innovators anchored by a consortium of the leading children's hospitals motivated to accelerate health innovation and transform care in pediatrics. Now I want to introduce you to an emerging technology company that has been enabling the use of telehealth in schools to improve access to clinicians providing urgent care and mental health care while kids are in school. I sit down with Andrew Post, president of Hazel Health, to talk more about his company and how they're helping schools improve the health of their students through innovative technology. Andrew, thank you for joining us.
Thank you for having me. Really great to be here and excited for the conversation.
We've been talking about how schools are a really important part of the ecosystem of keeping kids healthy or just tracking kids' health and wellness. Hazel plays an interesting role in that space. Tell us a little bit about your perspective about the school and how it plays a role in children's health.
I appreciate it. It's a great question. And I speak as somebody who has spent a decade and a half of my career in public education, from teacher to assistant superintendent. And I can say that the term that I would use is school-centered care. I know school-based care is probably the most often term for healthcare in a school setting, but I would use school-centered care. And the reality is it's where children are. So I get the unbelievable opportunity to talk with health plans and school districts and states alike every day. And this reality that children are there, at least hopefully there most of the time, really breeds an opportunity to harness the nature of not only them being there, but them being connected. Their parents or caregivers being connected to the school in a way that allows us to amplify the outreach and the channels to work with children and families through school. but being very careful not to make it the school's responsibility to deliver. And I think that's the fine line.
Let's take a quick step back and talk about the problem we're looking to solve here.
I would say it's a problem or an opportunity within the broader ecosystem, which is that unfortunately, if you look at the data today, nearly half, if not more than half, dependent on community of children are not having their well child visit. The one point in time that the US healthcare system is designed for which children will be seen for prevention, early intervention, that is not happening at scale. And likewise, there's plenty of data to support that healthcare in general, but specifically mental behavioral health, is 6 times more likely to get to a child through a school construct. The reality, I would actually say, goes all the way from identification of need to assessment of need to delivery of care is not reaching the children who need it at the levels that they need it from either a preventative standpoint or an intervention standpoint. And unfortunately, schools then bear the brunt of untreated, unmitigated healthcare needs in the form of both disruptions and concerns within school of children also simply not able to be fully present even when they are present.
So then tell me about Hazel. Where does Hazel fit in as a solution? What do you guys do?
Hazel Health is the largest, hopefully most trusted deliverer of telehealth through K-12 schools in partnership with K-12 schools throughout the nation. And so what we deliver is a combination of physical healthcare services, more aligned today in the acute care telehealth intervention space, but identifying when there is opportunity to use that encounter to reconnect a child with their primary care physician, their PCP, in hopes of actually supporting the overall wellness regimen of that child while meeting the needs that they have right here and now. And then we also deliver mental behavioral health care through the same platform, again, in school and outside of school, but all in partnership with school districts. And so, again, very important about Hazel Health is we are not a silver bullet. We are a wonderful solution and a wonderful member of a pediatric wellness well-being ecosystem to meet the needs of children and families. But ultimately, we provide the care that children need, where they need it, when they need it, for how much they need it, and are acutely aware of our role in making sure that we then are linking them to community-based providers, FQHCs, community mental health centers, PCPs, so that we are not the end all and be all, but we are a channel into or back into the wellness regimen that is best for children.
So let me understand a little bit more. So my kids go to elementary school. There's a school nurse there, and she does a great job of taking care of them when they have that issue. So tell me what Hazel does above and beyond kind of what the school nurse has historically done.
Yeah, school nurses are a favorite. And so my clinical team would tell you this is the least exciting example. But as a parent, I too have children in grade schools, one in middle school, one in elementary school, and one in preschool. Let's take the case of pink eye. At least in my experience, most school nurses are not able to address pink eye for what medical intervention needs to happen or even diagnosis, but ultimately can identify that there is a concern and call the parent or caregiver and make the child comfortable in the meantime, which is an incredibly important role of making sure that the school stays safe and healthy and that child gets what they need. If that school has Hazel Health, that school nurse can effectively push a button on an iPad that we provide, and as long as the parent or caregiver is given consent to treatment, we are able to see that child with a pediatrician, nurse practitioner, physician's assistant within a matter of minutes, diagnose that pink eye, call in a prescription, call the parent to pick up that child, but then they can start the regimen right away and the note back to school is in the child's file. That is more of an acute care kind of routine, not, as my team would tell you, that the highest interest clinical encounter. But we also see children who, for example, have asthma concerns. It may be months before they are able to get an appointment with their specialist or their pediatrician. They are in the office and that nurse is doing their best to support them because they are wheezing. And it turns out they just don't have their inhaler and they're out. And so where can we plug in not only to help them maybe get an albuterol pump and be able to right size their current condition, but also to call that pediatrician or specialist and see if they have an opening to more quickly see that child, because clearly their current needs aren't being met. And so they're ending up in the nurse's office where, unfortunately, in most cases, they have a limited amount of intervention that they can apply.
That makes sense. So you're basically an extender or an adjunct to what's already currently happening. And I imagine some schools don't even have a nurse or a health aide in their school because it's not a luxury that every school has. And then on the mental health side, how does that intervention work?
Our mental behavioral health solution is delivered again in partnership with schools and parents and caregivers. 80% of our referrals today come from school district personnel. Most of those are school counselors, some of them are school social workers, some of them are assistant principals. And you could think of it as our team works with those individuals to train them as referrers to understand two things. Number one, what symptoms, what behaviors, what might you be identifying that would suggest that a referral for behavioral health assessment would be in the best interest of that child, full stop. And then how do you actually access our platform to make that referral to Hazel?
Just
This
a
is
quick
all.
question there. Does a parent have to agree to the consult?
So we have to follow state and federal laws. In a state like California or Colorado or Washington, where there are very explicit minor consent laws at certain age limits, that child could seek care for themselves if they are at or above that age limit. Otherwise, it would require a parent or caregiver consent.
What age do you start treating patients?
So we will see children starting at age 4, typically. And you can imagine that 4, 5, 6, even into age 7, has engagement utilization of both services. Mental behavioral health, maybe a little bit lower on the overall engagement. And then as you get into 4th and 5th grade in particular, through middle and high school, is where those service needs, or at least through us, ramp up.
Who pays for the service? Is it the insurance company of the patient? Is it the school district? Is it parents paying? How does it work?
So we have a very interesting model in which traditionally the school district pays a platform fee to have access to everything I talked about and ensures that every child who needs care will get care when they need it. And then health plans, by and large, pay the direct claims, assuming that the individuals have insurance. We are a network. All of the kind of regular billing apparatus of working with health plans is in effect. And then our model today ensures that the parent or caregiver is not on the hook for payment for the core services that we have today. So if there are higher acuity care services or anything that kind of goes beyond that, there is more of a kind of general healthcare setting, but the idea of making sure that we are available to everyone, at least by and large, falls on that shared responsibility between the school district. In some cases, it's the state that pays the platform fee or just the access fee.
What about Medicaid? Are you taking Medicaid in any state yet?
In all the states we operate in, we take Medicaid.
That's great because, as everybody knows, almost half the children that are seeking acute services are on Medicaid in most states. It's a large population in most states.
In the school districts we partner with, by and large, the number is far north of half as well. And so it is an imperative to really reach the equitable access that we look to set forth for children and families, that we take Medicaid, CHIP, and commercial insurance, as well as serve uninsured.
That's great. You guys have been at this for a while now. Is there data showing that it's working, that kids are absent less, they're getting healthier? I mean, do you have any outcomes data you can point to at this point?
We do. Number one, that we materially expand access and make access actually accessible. And there's data points that I could give you for that. The second is that we use that access to drive meaningful engagement, that ultimately this is not a platform that simply exists, but exists and is actually being used by individuals. And I can give you data points on that. We have seen really great data out of places like Duval County in Florida, Paramount in LA County, Ferguson in Missouri, where we are reducing absenteeism by anywhere as much as 11 days of absences following services. A study out of Paramount in LA County showed that anywhere from 41 to 44% of the children that receive services from us about midway through the school year didn't miss a single other day the rest of the school year. And so when you talk about chronic absenteeism, our ability to impact that is really an important point. On the healthcare side, we also have a study with HealthNet actually in California that showed a really significant reduction in cost of care for that child across their higher acuity care and other related expense services to the tune of almost $2,800 per year per child that we served. And so we are expanding access. We're using that access to create meaningful engagement.
Andrew, thank you so much for joining us. As always, learn so much when I talk to you guys. And it's great to see the work you're doing in schools because I personally believe that schools are such a important part of a child's ecosystem. So thanks again.
Omkar, thank you for having me. Love the conversation.
All right, thank you for joining us for your dose of optimism. Make sure to check out our show notes to get more information about our guests and the work they're doing. Visit our podcast page on the KidsX website to join our podcast community and to learn more about pediatric innovation. Thank you to our sponsors and to our presenting partner, KidsX. Please subscribe wherever you get your podcasts, and remember, it takes a village to make sure our kids grow into healthy adults. So volunteer at your local library, help out at the community center, and thank your crossing guard. And if you're so inspired, donate to your local children's hospital. All right, see you next time.